Hey everyone, welcome to the series of 73 questions with specialists, where you get to know some incredible medical professionals through a round of rapid fire questions. I am Naushad Khan, a medical student, and today we are going to dive into the world of orthopedics. So let's get started and meet our incredible guest today.
Hi, Naushad.
Hello, Dr.
Welcome.
Kate. Welcome. Welcome to the series of 73 questions with orthopedic surgeon.
Okay.
So, are you ready to get started?
Yes.
Okay. Here are your questions. First question, what's your name and specialty?
I'm Dr. Prashant Kate. Specialty is orthopedic surgery.
Welcome. Nice. Now, going on to your education and early career, where did you do your medical school and specialization from?
I did my medical school from, that's the thing, alma mater, Bairamji Jijiboy Medical College, Pune, and my post-graduation also from the same institute.
Wow.
Why don't you have a seat? Yeah.
Thank you. How many years have you been practicing for?
I've been practicing since 1995. That's almost 30 years now.
Wow, great experience.
Yeah.
When did you decide you wanted to be a doctor?
Not really. I mean, it just happened. I never sort of predetermined what I wanted to. Initially, I wanted to be a cricketer, so that was how it started. But soon realized that cricketing career isn't a wholesome one. So when I got admission into the medical school, I just took it. And obviously, my parents also were teachers in medical college, so they were there to guide me. Yeah.
Okay, I see. Wow, from cricket to med school, and yeah, your parents were there. What specialization did you have in mind on the first day of medical school?
First day of medical school, just getting through the day was the main issue rather than thinking about specialty or something. And even till the final year of MBBS, I mean, it was just getting through the curriculum rather than, the future, what you wanted to become. But definitely I was more inclined towards surgical field rather than the physician field. And I did my first year of medical school from Goa Medical College, Bambolim, that's Goa. And second year onwards, I was in Bairamji Jijiboy Medical College. So the first day, obviously, that was the first day I was in a hostel. So the funny thing is, since that's a small college in Goa, we had 60 students over there, and I joined a bit late. So, and I was given a room, which was a single room, which was not obviously for the regular students. So everyone was thinking that I'm some kind of a examiner or something. So initially I didn't face any problems of, say, ragging or any such thing. And slowly the guys realized that I was in the first year.
Oops.
So and then you got to know a good amount of people there. So that's how it is. The first day, never. I mean, just getting through the day was more important.
That's what our last guest told about. First day was like you were just in the moment. It was hard to decide.
Yeah.
Wow. What other medical specialty would you have chosen?
I don't think. I think once I did a year of general surgery, and I was a resident in the pediatric surgery unit in BJ Medical College, Pune. But when I got into orthopedics, I mean, I actually had sort of thought that I had got my calling, because it was so much kind of gelled with my personality, and moreover, it didn't require too much of bookish knowledge. So it was more practical oriented, the orthopedic surgery. So that was kind of, I don't think I would have done anything else.
Wow, that's interesting. It's kind of like, finding your way, like your path, like you're just finding your path in the moment.
Yeah.
On that note, what is one specialty that is definitely not for you?
I think gynec.
Gynec? Why is that answer getting common now? Okay. Now, talking about your specialization, what inspired you to become an orthopedic surgeon?
There's a backstory, kind of a back end story of it. My father was a professor of anatomy, the first year, first subject that you get. But it's interesting that he took up that subject of anatomy maybe in the 50s or 60s because he had got into orthopedics in Bombay, but he was in Nagpur, so he didn't want to go to Bombay because there wasn't any sort of monthly pay involved in that.
Okay.
And since he was coming from a village, he was more bothered about the economics rather than the path of orthopedics. So he actually wanted me to become an orthopedic surgeon because he said that's what it is. I mean, that's a good field. But I never sort of studied towards it. It just happened. I mean, I got orthopedics, I took it, and then I was just okay. Yeah, that's for me.
In the flow.
Yeah.
Yeah, and anatomy and orthopedics kind
Yeah.
of seems very close, right?
Close, yeah.
So, what type of surgeries do you perform most frequently?
Mostly here I get mostly trauma surgeries, various fractures in elderly also, and joint replacements too. I mean, I do total hip replacements and total knee replacements also, but mostly it is trauma.
Okay.
Fractures of maybe hip fractures, long bone fractures, those kind of things.
I see. What's the biggest myth about orthopedics you'd like to debunk?
You require too much of strength to be an orthopedic surgeon. I mean, that's not true. It's mostly the technique which is important, and that technique is pretty logical. I mean, if you think of it, it's very logical. If you need too much of force, you're doing it wrong. So it's more of a skill that is there.
Well, that certainly cleared one of my misconceptions because I've seen most orthopedic surgeons to be like nice, bulky, and with a good build.
Oh
So,
yeah,
yeah.
but you don't require strength.
What's the stereotype of an orthopedic surgeon?
As you just now described that they are tall, maybe hefty, or with strength in something, and that they drink a lot. So
Oh, that's
that's
new.
the stereotype. That used to be the stereotype even in the residency days. I mean, the floor on which the orthopedic surgeon stayed used to be the loudest floor.
Wow.
So there was a reason to that. I mean, you have in the 6 days of your week, we had 2 operation theater days and 2 OPD days. So you barely have any time for any recreation or something because the cycle of OPD and other things started. So whatever time these fellows got, they partied hard. So that used to be the thing. Yeah.
Study hard, play harder, right?
Yeah.
So, do you think this stereotype is kind of true for you?
No, not really. I'm a teetotaler.
Okay, wow.
So it's not true for me. But
Okay. For what kind of person is orthopedics the right specialty?
anyone who's good at logic and uh, sort of wants to learn new things because newer techniques are coming in and newer implants with their own way of doing things are coming up. So one who can adapt to the changing times. I mean, that's orthopedics for you.
So, on that note, for what kind of person is orthopedics not for?
Actually, everyone can. I mean, there's nothing. See, as you would say that for other physician, you require a good skill, communication skill. Here also, you require good communication skills, and at the spur of the moment, you have to explain everything to the patient. So you require someone who's cool-headed. I mean, so if you are too impulsive or too illogical, I mean, that's not for you. And you have to witness a lot of blood. So basically, you have to be aware that those things are part and parcel of your life.
Kind of staying calm and being there in the moment,
Yeah.
trying to figure the right way
Right.
across it. Okay. How do you think AI and robotics will impact orthopedic surgery?
AI and robotics, they are upcoming field, but I mean, they are more would affect the arthroscopic procedures as well as the replacement procedures rather than the fracture treatment, because each fracture is different and unique. Each anatomy of each fracture is different, so you just cannot. I mean, and moreover, they have tried robotics in replacements, but those people who are using those robotics are now have almost given up those, because once you get used to a procedure, it's much easier and much faster you doing it yourself without any assistance of any uh, AI or robotics. So
Your hand skills get better.
Yeah, skill sets are much better. But maybe in the future that should change. I mean, as the robotics develops, things would be different.
I see. How many hours a week do you work?
Uh, seven, uh, 7 hours a day, so that would be about 35 to 40 hours.
Okay, that's good.
Yeah.
That's doable. Wow.
Uh,
Can you describe a typical day in your life?
my day is basically concentrates around or revolves around the exercising that I do. Early morning, first thing in the morning, I go for cycling for about 35 kilometers. Then from 10 to 1 and evening 7 to 9 is the OPD hours in the hospital. And evening time, usually there is a 1.5 hours of brisk walking that I do. So it revolves around that. And whenever those patients come in for some surgery or something, then the timings are adjusted according to that.
You know, one of the reasons I really wanted to have you as a guest is because I've seen you cycling, and you are one of those inspirations. You know, I love doctors who are like, who care for their own health. So that's one of the reasons.
Basically, it's habits. You develop those habits, and that is more important than how much actually you exercise. Habit, getting into the habit of things is important. Routine. Yeah.
True. How many patients do you see in a day?
Typically 10 to 15.
Okay.
Or purely orthopedics. I don't see anything else other than orthopedics. Yeah.
What time do you wake up?
I wake up in summer times at around 5 o'clock, in winter times around 6.
How many hours of sleep do you get on average?
7 to 8.
7 to 8. Good. How do you stay healthy and manage the demands of your job?
It's just dividing or prioritizing what you want to do. So basically exercise, and then the whole day is open for the surgeries and the profession. Yeah.
I see. How do you stay focused during long surgeries?
A lot of these exercise, what you do, helps you in your surgeries, long duration or whatever.
True. It carries on.
Yeah, it carries on.
How do you handle emergencies in an operating room?
We always have a assistant with us, so there is nothing. You're basically planned for most of the things. It's nothing like something comes out of the blue. That doesn't happen usually.
Okay. Now, going on to some professional insights, what's the most challenging aspect of being an orthopedic surgeon?
Whatever time the case comes, you have to be there. So even at night, 2 o'clock, if a case comes, you have to be completely aware of what the patient wants and what he's going to face. So that everything you have to be aware of that and start explaining to the patient, because patients want everything in a jiffy. They want the whole plan laid out, whether it's 5 o'clock or 3 o'clock in the night, it doesn't matter to them.
That's one of the hard parts, right? How would you convince a medical student to choose orthopedics over other specialties?
I would try to convince anyone of any thing that he wants to do. I mean, they're free to go. If he likes it, he likes it. I won't be there.
It should be the calling.
I won't be devil's advocate. So.
Okay. What is the most common diagnosis or problem you see patients for?
Wrist fractures, basically. Wrist fractures are the most common.
What's the most rewarding part of your job?
The satisfaction of seeing the patients walk again after their illness or their fractures, and getting their movements and everything back. That's the best part of satisfaction.
True. What's the biggest risk associated with orthopedic surgery?
See, there is always a possibility, always a possibility of a deep vein thrombosis in lower limb fractures. And it's very difficult to explain to the patient what happens and why it happens. That is one thing which everyone dreads.
Yeah, we almost always get a question on that too.
Yeah.
What's your approach to managing patient anxiety before surgery?
The confidence that you show in yourself and reassuring words that you speak puts the patient at rest anyways. I mean, that's uh, the most common thing that we do. We don't say anything other than that. This reassurance is more than enough.
It reflects.
Yeah.
What's the most important skill for an orthopedic surgeon to have?
As I said, he should be able to envisage what the outcome is going to be right on day one, to properly explain to the patient what are the limitations of the treatments and what is the best case scenario and what is the worst case scenario. That is important.
How do you collaborate with other medical specialists?
Uh, Mainly, we require, say, a physician who's always on toes, anesthetists, and radiologists. Maybe. So, communication is the key. So, you communicate with them what you expect out of them, with the physician, how quickly you want to operate the particular patient, so that he is uh, pretty fast enough to come and see the patient and not, tell a lot of investigations to be done just to complete the investigations rather than looking at the patient's early surgery.
Okay. How do you manage your work-life balance?
Whenever there is work, you work. The other time is balancing the life that you lead. That's all.
Can you describe a memorable case that had a significant impact on you?
There are lot of them. I mean, elderly patients, who are uh, almost on the verge of, giving up. And there was this one patient who was an elderly lady, and the physicians came and said, "Oh, she's not going to go live through this," and walked off. And I had to call another physician, and that physician saw, and we operated on that patient. So I had to go to that lady's place for some other reason, to meet her son or something, and she was the one who opened the door for me. So it's like never give up. So whatever the patient is, however bad or good, you do your, uh, as they say, you do your karma. That should be okay.
Wow. What's the funniest case you remember during work without violating confidentiality?
Um, Funniest case, I mean, there won't be any funny cases here because patients have a lot of trouble, a lot of pain. So there's hardly anything fun part involved in that. So,
Serious.
okay,
Okay.
yeah.
How do you think being an orthopedic surgeon impacted your relationship with your family?
The best part of orthopedic surgery is that you're not busy 24/7. You're busy only when the patients come. So, so yeah, I had enough time for my family. I mean, that's what I think. So,
That's good. How many steps should you walk in a day?
I mean, they recommend 10,000, but I mean, even 5,000 is okay. As long as you are moving around and active, should be fine.
Okay, that's from an orthopedic surgeon.
Yeah.
How do you think your specialty has changed over the years?
As I said, all newer technologies have come in. I mean, when I was a student or I was a postgraduate student, we hardly operated on knee replacements or hip replacements, or even that time the tibia nails were pretty rudimentary. Now you have a interlocking nailing wherein you pass the nail and then a screw is passed across a hole which is there in the nail, proximal and distal to the fracture. So it's like you're locking that nail. So these kind of developments have happened because I think we've got the portable X-ray machines and C-arm, what we call as a C-arm, where you can see the live X-rays on the TV screen. So, but these things are all we learned on hands-on after we passed out of the medical school.
Wow, it's like ever developing and so interesting.
You just have to keep up on the newer things which are coming up and adapt to them and use them properly.
I see. Who are you most thankful to from your hospital team?
All the staff is they're amazing. I mean, they keep on working, and you won't believe almost all the staff which is there in my hospital right now have been working with me for almost 20 years now. So they have been pretty steady about it.
Long-term relation.
Yeah.
Wow. Okay, now jumping on to some personal life and preference questions. What's your favorite memory from your childhood?
Oh, about in Nagpur? Yeah, I had my childhood in Nagpur. The most vivid memory was 15 to 20 people staying in one compound in a house, and all of them elderly to me. They were all engineering students at that time, and we were staying opposite the LED college, which is there, and all having fun. I mean, all five or seven houses around the house which we were living. Everyone used to come and have a great time in the evenings. That
Good
was,
old days.
yeah, definitely.
Now, so what's your favorite memory from med school?
Med school, yeah, the friends that we made, I mean, across the classes. I mean, so not restricted to my own class. Maybe in my own section or class, I wouldn't know so many people as I knew somewhere outside. The other classes, I mean, seniors and juniors as well. And the funny thing is, I mean, we were organizing an All India Intermedical Cricket Tournament. Teams used to come from all over, from Kanyakumari to Kashmir, everyone, Ludhiana, you name them, and they used to come. And we organized it for 5 years. So for that 5 years, you needed a lot of volunteers who would work for you. So those 5 years, you sort of got to know those five generations, newer generations that came into the medical school. And so we have, even today, we have a core 7-member group who go on for a holiday every year without fail. Locations everyone decides whether it's abroad or in India, but definitely we meet at least once a year. All of them are doing very well in their own fields, but we definitely meet.
As everyone says, it's those relationships and those friendships
Yeah,
that stay forever.
yeah,
Exams will pass.
yeah, exams.
So now, what would you have done if not be a doctor?
Or maybe a cricketer, maybe, yeah.
Of course. Do you have any kids?
Yeah, two of them. One Raviraj and Shreya.
Okay, so because I know them, I wanted to ask this question. Why do you think they didn't choose medicine?
I wasn't very much for it because of the length of the study time. And plus, see, when we were students, the medical school was very different. Now it's completely changed. Even I wouldn't be wanting to be in a medical school right now because all the competition, the competitive exams for each and everything at every stage takes out the fun of it, of studying as such. During, see, I joined medical school in 1984, 85. That time the whole exam was different. The way you got into post graduation was different, and that's why you see undergraduate and postgraduate in the same college. Nowadays, you would hardly, you won't get into an undergraduate college of your area. You won't get into postgraduate. So, in a way, that's better in the sense, from the point of view of national integration and all that. That's political. I mean, from personal perspective, I think it should be like the old times, where your area, you become doctors and you sort of, cater to that area. Uh, I think that was a better deal than what we are having right now. I mean, it's chaos right now.
I can totally relate
Yeah.
with the med school exams and everything's that happening right now. It's with
And
us.
nothing
Yeah.
happens. I mean, I wouldn't say that you're getting brilliant doctors now and you weren't getting brilliant then. I mean, so both these systems are, you wouldn't choose between the two. Anyways.
Yeah, it's hard to choose, but yeah, it's a change which is
Yeah.
kind of not
Which everyone
always
wants.
right.
I mean, yeah, you want something to change. You think that's the utopia. It isn't. It's putting a lot of pressure on young kids.
Too much. Yeah. Okay. So jumping on to the next question, how do you unwind after a long day of work?
Uh, Maybe an ice cream.
Wow. So what's your favorite flavor?
Favorite flavor is Kesar pista.
Ah, I like that.
Yeah.
What's your go-to stress relief method?
Maybe exercising. That's relieves a lot of stress.
Yeah. Are you good with other hardware, instruments, and tools, and a handy person?
No, I haven't tried. I mean, I wouldn't try repairing something.
Okay.
I won't.
Because that's the image most people would have of an orthopedic surgeon,
No,
really
no,
good
no,
with
no.
tools. Okay, I see.
Each his own. I mean, good people, everything as an expert. So let them do those work
True.
for that expert.
What's your favorite tool or piece of equipment to use in the OT?
Brain.
Oh, wow. I love that answer. I was expecting an instrument. Okay, very nice. Now, jumping on, do you ever get asked for medical advice from family and friends?
Yeah, always there to give free advice.
And what's the weirdest question you have been asked?
I can't recollect actually.
Okay. What's a special talent you have?
Maybe smiling in adversity, even in adversity.
That's special. If you could go on a meal with anyone from history, who would it be?
History. My dad maybe.
So hypothetical, where would you take them for the meal?
Uh, he loved very simple food, so maybe home only.
Wow. So nice, lovely.
Yeah.
If you won $1 billion lottery, would you still be working in medicine?
Yeah, definitely. That's especially orthopedics. I mean, other branch I would say orthopedics I would be working. I plan to work till the end. So
How would you spend $1 billion in a day if you could
maybe travel.
travel? What's your favorite holiday destination then?
I've been to Queenstown twice, New Zealand, and that's one of the best places to be there. So relaxing and nice, basically. But anywhere out of the routine, your home is fine. At least once in 3 months.
Wow. Yeah, I know you travel a lot,
Yeah.
and that's a good suggestion. I'll have that on my, bucket list kind of thing where to travel. So you are a tea, coffee, or soda person.
Tea, coffee.
What's your favorite orthopedics related movie or TV show?
Orthopedic related. I like that a movie, nothing related to orthopedics. It's a Richard Dreyfuss movie. Whose life is it anyway? It's about euthanasia, and the person gets. He's an artist who, in an accident, meets with an accident and has his spinal cord at the cervical level cut. So he's quadriplegic, and he wants to sort of have euthanasia, but he's unable to because he can't move his hands and everything. So he fights against the system and says, "I can refuse the treatment that you're giving me."
I see.
So a very beautiful movie. If you haven't seen, just see it.
One question from our last specialist, Dr. Vyavahari, an anesthesiologist. What could be a reason of rising attacks on doctor, and how could we prevent them?
Lack of communication.
Okay.
That's the basic thing. And maybe transparency about what the charges are. And then again, maybe a bit of empathy with the patients. If they are not able to afford certain things, you just negotiate with them, and you have to run a hospital. So it's not that you will be doing everything free.
Yeah,
But
it's
lack of communication. Even in government hospitals, you do get these kind of attacks. But that's because of lack of communication or arrogance coming across.
So now jumping on to our next question. Every superhero has a superpower, and for us, you are our superhero today. What is your superpower?
Superpower, being normal. I mean, being normal is a kind of a superpower that you should have.
I see. Yes. Of all the achievements, which one do you think has had the biggest impact in the world? Of all your achievements?
Of my achievements.
Yes.
I haven't achieved much anyways. I'm doing the whatever routine things that I'm doing. So it's nothing is at the top of it.
You're being very humble.
No, really.
Okay. Well, you have made a huge difference, like serving everyone all these years.
Yeah, that's the normal. That is what is expected. So nothing something out of the ordinary or something. You don't want to be that. I mean, this life, be normal.
Wow, that's a take-home message, you
Yeah.
know. Wow. So, what's your favorite inspirational quote or mantra?
कर्म करो फल की चिंता मत करो. Do the deed. Don't worry about the results. The results will follow. I mean, if you follow a procedure, a pattern, the results are there too. You get the results.
Right. What's the best piece of advice you have received?
Do your best in whatever you do, and don't bother about the results.
Do the work, put in the work. Can you suggest 3 books for our viewers that would have a great impact on their life?
So one of these books is Robin Sharma. One of the books. I mean, The Monk Who Sold His Ferrari.
Yeah.
That's a nice book. I mean, but there is a stage in life when you should read it actually. So for younger ones, it's difficult for them to go through that. But maybe in your 30s, late 30s and 40s, I mean, you would pick up that book and read it.
Okay.
That's a good book to read. Others, I would just don't come to my mind right now.
Okay. Thanks for that suggestion. For our late 30s, we have something now. Okay, we have been through most of the questions. We only have a few left. So, some reflection questions now. Did you ever doubt if you could be a doctor?
No, not really. Once I got admitted, I was pretty sure I would get through. Because in medicine, I think you read persistence rather than a lot of brilliant intelligence or something. You need to be persistent with everything.
Keep pushing, yeah. So, what gets you excited to work?
A new day.
A new day. I love your answers, you know. I've been enjoying this. I'm sure you have had your fair share of struggles in life. Can you share one and what it taught you?
Struggles getting across the officials of government officials for your day-to-day kind of needs is a big headache. And so many, the hospital, you require so many approvals and everything. And previously they were doing it every year. So it was, I mean, apart from your area of core competence, you were just, doing clerical job. That was the problem.
A lot of friction over there.
It's not friction really, but it was kind of, just had to keep on doing the routine things, the same things over and over again. I mean, collect the degrees of the staff that you work for, the fire NOC and all those stuff.
All that, okay. So, next question. How do you envision the future of orthopedics?
Pretty bright. I mean, new things are coming up. So, it should be good. I mean, new concepts, it's like a pendulum. We go on from the old concepts to the newer ones, and then you realize, those old ones were good enough. So you go back to them. So
Interesting.
Yo-yoing, yeah.
If you could go back in time, would you change any of the experiences that brought you here today?
Not really. No.
What's your advice for aspiring medical students?
Don't bother about the results. Be persistent and be sincere and honest. Yes. You should get through that.
A question asked mostly to medical school applicants. Why did you choose medicine?
Medicine chose me rather than I was. As I told you, I was playing cricket. I played for under 19 cricket team of Maharashtra. Represented Maharashtra for a year. That was my 12th standard. So I was studying also, and plus I started studying for the medical school or 12th standard exams. Those who used to have admission via the 12th standard PCV marks. So I started studying after December, once the Kuch Bihar trophy got over in November, December. I really started studying after that for my 12th standard. So I had to give up on maths because a lot of that integration and differential stuff, I would never get it because I was never there when it was taught. So the best thing was for physics, chemistry, and biology, the trial. Biology was simpler. You could read the books and understand.
If you could give a life advice, what would it be?
As I said, be honest.
Be honest.
Sincerity and honesty.
What's your advice for aspiring orthopedic surgeon?
Learn new techniques, the newer things that are coming up. There's a lot of specialization in every field. We call ourselves general orthopedic surgeon because we do everything. But nowadays the trend is the arthroscopist is a different person, the joint replacement person is a different person, ankle and foot surgeon is a different person, hand is a different specialty, and spine, this thing is a different specialty. So focus on what you like and focus on that particular specialty, and that's the way forward, as I would say.
Well, we went over this in a way. Would you recommend medicine as a profession?
Definitely, if it was say 30 years back, now it's different. I mean, in BJ Medical College or Bairamji Boy Medical College, there used to be what you call as an art circle. That art circle used to have stalwarts like Dr. Sriram Lagu, Dr. Jabbar Patel, Dr. Agashe. They all came from that background. Now you go there, it's all secluded. No one is there because most of the students are coming from all India exams. So they are from outside. They don't know anything about the local culture. So you don't have that. It's become redundant now, the art circle.
I see.
That way. That time, it used to be, we used to have good fun. I mean, 1.5 years was the period of 1 year, out of which people used to study for 3 months. The rest of the year, they used to have a good time, celebrating various get-togethers and other things. The gathering, annual social gathering. Then there used to be a hostel gathering. So, part of the thing was there were always students who were free from exams in those 1 year. So you used to have continuously have good entertainment and entertaining time we used to have. Nowadays, everyone is in the books, reading the multiple choice questions, multiple choice. It's crazy. Yeah.
Tell me about it. I've been doing that. Okay, so here's the last question. If you had the power to change something about medicine and healthcare, what would you change?
About really nothing. I mean, in India, since we cater to such a large, huge population, it's very difficult for you to, get efficiency into that particular government hospitals or something. The way government hospitals function, it's sometimes it's amazing. Sometimes it's what you get the criticism in the papers. That's true. So it's kind of a mixed bag. I mean, won't change much for it. Maybe more efficiency in the way they handle things in the colleges. But on their part also, they are restricted or they're hamstrung because the number of patients, that sheer load that is there. You go abroad anywhere and people don't see more than that number of people, patients. And so you have in NHS in UK, you'll have a 5-year waiting period for a surgery. So that's crazy. I mean, that we don't have in India. So there are a lot of positives in Indian healthcare scenario. You can get your MRI scan done or an X-ray done or a USG done just by going to the doctor. That's not possible in the US. And so, though they are so, everyone is in awe of them, there are a lot of missed opportunities over there too. I mean, people get diagnosed way too late as compared to maybe in India.
It's hard to pinpoint something.
Yeah.
It's just the systems, and we should,
Number of patients, if they become less, I don't think there should be a problem. But then how do you do that? Control the population first.
Biggest country. Okay. Wow. So we are done with your questions.
Good.
Now, before we end, if you could ask one question to our next specialist, what would that simple medical question be?
What's changing in cardiothoracic surgery?
So thanks everyone for watching. That's it for our 73 questions with Dr. Kate. Thank you so much for being there. Thank you so much for being there. And let us know what was your favorite question. And if you have any questions you'd like to ask our next guest, please comment them down below. And make sure to like and subscribe and share the video with anyone it would be of help. So thank you guys. Thank you so much, Dr. Kate.